Hello friends, let's today talk about cemented hip replacement surgery. Normally there are two types of hip replacement surgeries. One is cemented, in which we use cement for fixing the components. The other is uncemented, in which we do not use cements for fixing the hip replacement components. A mixture of these two is also available, which is known as hybrid fixation, in which we use cement over one component and the other component is uncemented. Typically when we use the word hybrid, that means the stem is cemented and the cup is uncemented. There is something known as reverse hybrid also, in which the acetabular cup is cemented and the femoral component is uncemented. So let's today talk about the cemented hip replacement surgery. Normally it is indicated in elderly people, osteoporotic people, and especially in women above the age of 65, because this lowers the periprosthetic, femoral fracture risk, revision risk, and the results are better. It is also done for displaced femur neck fracture where arthroplasty is indicated. That means the neck part of the femur bone, when it is fractured in elderly patients, then also this might be an indication, because this allowed full weight bearing and immediate weight bearing. Sometimes when the femoral canal is not normal, like typically what we call the stovepipe canal, or the patient has undergone previous radiotherapy, or there is severe osteoporosis, and we are not sure whether we'll get a secure press fit stability of our implant, then also cemented stem is a very reliable option. Main advantage of cemented hip replacement is it gives early recovery, early mobility to the patient. Now here it is important to remember that normally in young patients where the bone quality is good, cementless fixation also gives very good result. But in older osteoporotic patients, often we go for cemented fixation. Now when we talk about the survivorship of this cemented hip replacement in elderly or indicated patients, National Registry shows us that around 10 to 20 years of very good survivorship. Normally we say around 15 years or 18 years. That is more practical. But there are a lot of factors that determine how long your hip replacement is going to last. Normally when we talk about the factors, basically it depends on how the patient is going to use the hip implant that we are going to put. Like age of the patient, we have already discussed about it. There is some discrepancy between the genders also. Females typically they require revision at a younger age or after as compared to males, little earlier as compared to males. Also diabetes affects the survivorship overall. The smoking status, that also affects the overall survivorship. Of course the implant choice and the technique also makes the difference. The implant technique, by implant technique I mean the proper placement of the implant components. That affects how the overall outcome is going to be. Also what kind of stem design we are going to use, whether it's a taper slim or a composite beam, and there are other materials also, and there are a lot of materials also available, like we are using a ceramic or a metal component or metal hip, or we are using a polymer. So when we talk about the overall indication and survivorship of the cemented hip replacement, normally it is reserved for elderly patients only. We also spoke about whether it is a fully cemented hip replacement or a hybrid or a reverse hybrid, because that also to some extent affects the survivorship. Normally for hybrid hip replacement, where we use femoral stem as cemented and uncemented cup, this is gaining popularity because revision rates are low. So overall, if you are planning for hip replacement and your doctor has suggested you cemented hip replacement, don't worry, trust your doctor, because your trust on your doctor is very important. Also you should work on your factors like weight, exercises, to avoid smoking. These factors are also going to help you in increasing the life of your hip replacement surgery. if there are any doubts or if you want to contact us, you can contact us on the number shown below. We'll be happy to help you in this journey of hip replacement surgery. Thank you.